hook in his foot as well.
On this week's Bondi Vet Top 5.
The hook's gone in, but the hook has actually gone into its digestive system.
Yeah, it'll be down in the esophagus.
Okay.
Yeah.
And if we can't get it out very easily, then we'll have to send him to surgery, unfortunately.
And just to see what kind of damage those hooks have done to this beautiful seal's mouth.
At number 5 today.
Now, I've treated some difficult patients in some difficult locations, but this might just top all of those. The open ocean and a shark, but today could be life-saving.
Chris is in the Sydney suburb of Manly. He's meeting up with Dr. Rob Jones and a team of specialist divers from Sea Life Sanctuary.
All right, so we're just about ready to go.
They're about to attempt a groundbreaking grey nurse shark rescue mission.
Rob? Chris, how are you?
Good to see you. Obviously didn't get the memo about the dress code.
No, but this is how we dress to save sharks, basically.
No, this could be quite the day.
Oh, look, really hopeful. Like, this could be just wonderful. I mean, these sharks are critically endangered. We know there's one out there with a hook in it. Yep. We've just got to get out there, hope we can find it, get it up, get the hooks out.
Not going to be easy, though.
Not going to be easy, but...
Look at my gear, you got yours?
We're good to go.
Let's get out there.
Okay.
The aim of today's unusual rescue is to try and save a young female shark which could be in serious trouble.
These sharks are classified as being critically endangered. There's only around 1,500 maximum along the east coast of Australia. These sharks are quite young in this colony where we're going into today, so they're essentially the future of the entire species.
Recreational divers spotted the distressed shark entangled in fishing line and with a hook in its mouth at Magic Point, a few hundred metres offshore.
I imagine these hooks, if they've been in there for a while, they're not going to be easy to get out.
No, some of them are pretty deeply embedded, and whether we'll be able to get the whole hook out or not, or just actually cut it off at the base of the jaw, we'll just have to wait and see.
Yeah. But we're on the clock, aren't we, once that shark comes out?
Once that shark hits the deck, 10 minutes is about the ceiling. I really don't like keeping them up for any longer than that.
Okay. But I guess the biggest challenge initially is first of all finding the shark.
Yep.
And then actually catching it, really.
Yeah, they're down in 16, 17 metres of water, so it's a pretty big task.
It will be a risky operation to try to save this injured and critically endangered grey nurse shark.
What we're trying to attempt today is essentially a world-first technique. I mean, we're going into a shark's habitat, trying to corral it, catch it, bring it to the surface and remove something that could ultimately threaten its life. So it's ambitious, it's risky, but we've got a good team today, so we're every chance. All right, this is the spot. It's called Magic Point. Trying to get the weddy on and get under there. There are a couple of really important stages in this whole process. First of all, I'm going to go down with the other team and try to find the shark that has the hook. The capture team is going to move in with what is essentially a large sock. On the base of the sock, there's a stretcher. If they can herd her into the sock, then they'll close it over top of her and bring it to the surface.
It's all systems go now, Chris.
It is.
Get down and bring up that shark.
In order to help this shark, first of all, we have to find her. So I'm heading down into the cave where she normally resides, and hopefully we'll spot her there.
But as soon as they get to the cave, there's a problem.
You look in there, and there are 6 sharks looking back at you. And these sharks are all of a pretty similar size, so we have to try to find the shark that has the hook. It's going to be tricky.
While Chris and the team are trying to find their patient, on deck, Rob is making sure everything is prepared for the shark's arrival.
We really want to try and have the sharks on the deck for probably under 10 minutes, so we do want to move and work pretty quickly. The sooner we can get it back into its own environment, the better.
The team is struggling to find the injured shark when suddenly one of the divers spots fishing line coming out of a shark's gills.
Now that we have a confirmed sighting, the capture team is now going to move in and bring it to the surface.
They have to work fast while ensuring their patient doesn't become stressed.
It'll be showtime. Fire up this oxygen. Yep. Okay.
With the shark now on the surface, the pressure to find the hook is on, and it won't be easy.
This shark is a female. She's more than 1.5 metres long. She's at that age now where she's setting herself up for hopefully a long breeding future. But this fishing hook and this fishing line could prevent all of that.
Chris, you want to grab that pole? Just see if you can see it.
I'm all too aware of the fact that we're on a strict time limit here. We only have 10 minutes with this shark out of the water. We've got to get moving.
The team can already see the fishing wire coming out of the gills. Now they have to find the hook.
Yeah, I can see some lines. Some line at the base of that tongue there. It's looking pretty deep, isn't it? Yeah. So the hook's gone in.
Yeah.
It's swallowed it down so far.
Yeah.
But the hook has actually gone into its digestive system.
Yeah, it'll be down in the esophagus.
Okay.
Yeah. Well, we can't get the hook out, but it's too far down, and we don't have endoscope or anything like that, so we're just going to have to accept that that's what it is.
Yep.
Hope it's one of those hooks that will rust out.
Okay. Whilst we'd obviously love to be going inside her and removing that hook, it would only put her life in more danger. So really, we have to cut the line at the level of the gills and give her some antibiotics and multivitamins. With some time, that hook should corrode and actually pass through a system quite naturally. Needle coming out.
Right, beautiful.
Coming up 8 minutes, Rob.
Thanks, Dave.
For this shark, really, we've done what we can. And given her body condition isn't too bad at the moment, she's a really good chance of mounting a really strong recovery. Now it's time to get back in the water.
Okay. Up and out. She's out of the water, so we need to move fast.
After all the mayhem of the last 9 minutes, she actually goes into the water quite gracefully. She's just gently caressed into the water and then swims off.
She's off. Very strong.
Yeah. And we managed to buy her some time.
She's going to have a much better chance now than she did half an hour ago.
Exactly.
No question at all.
Yeah.
Look, we're happy because this shark has now got a chance that it wouldn't have had before we did this today, and the whole procedure's gone smoothly. Everyone that we can get up, de-hook, has the potential to be a future breeding adult in this population. So pretty happy with the way it's gone.
Number 4.
At the Animal Emergency Service on the Gold Coast, Nathan and Natalie have brought in their German Shepherd cross, Ralph. He's had a nasty encounter with a fish hook.
Are you guys all right to bring him through?
Yeah.
Okay, all right, yeah.
All right, come on, Ralph.
Let's go, Ralph.
6-year-old Ralph has a fish hook caught in his tongue, and they're hoping Dr. Alex Hines can remove it.
He's obviously licked the hook because the hook had no food on it.
No.
So he's licked it, but in licking it, he's caught it in the left side of his tongue. So we could see where it was, and it hadn't gone all the way through.
Thank goodness he didn't swallow it. That would have been a whole different story. Hey, Ralph. But it's obviously irritating him because he keeps trying to lick it. For Ralph to get a fish hook through his tongue, that must have been so painful. Apparently, he let out a huge yelp, and I don't blame him. It's not a great situation, but yeah, it could have been much worse if he'd swallowed it. What I'm going to do for him is I'm going to give him a little bit of pain relief, and it'll also act as a bit of sedation as well, because he's pretty anxious here now.
He's an anxious dog anyway.
Is he?
He's on tablets every day.
He's on a plan for anxiety, basically, in dogs.
Takes anti-anxiety medication every day.
We'll work out a plan of how we're going to get that hook out of there.
It's all right, Ralph. You stay here with us. You jump in. Jump, Ralph.
Ralph is like, I'm not moving. You're all right, Ralph. Good boy. See Mum and Dad soon. It's okay. Good boy, Ralph. I think we're going to have to go very slow and steady with this boy because he is just anxious. And look at him, he's just looking back for his mum and dad.
Super anxious, aren't you, Ralphie? Hey?
Oh, that's got to hurt. It's hard to actually tell whether it's gone through his lip or it's actually into his tongue because he keeps moving around. It could have been much worse. If he'd swallowed the fish hook, we'd be trying to get it out of his stomach. The fact it's in his lip, this isn't a great day for Ralph, but it could be worse. All right, well, let me get him some pain relief.
Yep.
Give him a good dose because he's going to need something. He's a very worried boy, aren't you? You're a very worried boy.
It's all right.
Good boy. Doesn't hurt nearly as much as that fish hook, does it? At this stage, the plan's probably going to be to get Ralph nice and sedated, and then we're going to need to try to remove it, probably with a pair of bolt cutters, actually, to snip through the fish hook and remove it. If it does go through his tongue, it's going to bleed quite a lot because the tongue bleeds. So we're going to need to control the bleeding, get the fish hook out.
There you go.
But he's probably going to need some heavy sedation. He's not just going to let us put our hands in there and pull it out. Hey, Ralphie. It's your turn, mate. Oh, good boy. Up here. I don't know quite how we all go on this bench because he's a bit of a worry wart.
The German Shepherd Cross suffers from anxiety,
Right. Good dog.
so he'll need to be put under a general anaesthetic before Dr. Alex and vet nurse Lee can start trying to remove the hook.
At the property where Ralph lives, he looks after the ducks, the chickens, the geese, even the kids. He takes his job very seriously. In fact, he's on anti-anxiety medication because he's just constantly on the lookout. He is such an anxious boy, they really want to have him home tonight.
Yeah,
Because they just don't think he'll cope with a night in hospital.
Yeah.
And even now, he's just
He seems real stressed.
really stressed.
You're okay, mate.
While Alex tries to calm Ralph down, it's a nervous wait for his owners, Nathan and Natalie.
He was in shock, but then he was bouncing up and down, like he was, what's going on? Why is it hurting? And then he would start crying, and then, of course, there was blood coming out of his mouth.
Good boy. There you go. Are we ready? Little sleep. Hopefully when you wake up, it'll be all gone. Good boy.
With the sedation taking effect, Ralph finally starts to relax.
He's taking a lot of anaesthetic, I think just because he's so wound up.
Yeah.
It's taking a lot just to get him to sleep. Off you go. Good boy.
Do you want to help flip now?
Dr. Alex has been debating exactly how to get the fishhook out safely and is keen to get advice from colleague Dr. Lachlan, who's done similar procedures in the past.
Ralphie's got the fishhook and it's actually in the tongue, but the barb's not out the other side. So I was thinking of pushing it through so the barb's out and then cutting off the barb.
That technique certainly does work.
Yeah.
I have seen that being used. In my previous job, I have seen quite a few cases similar to this. And one of the other vets out there showed me a technique which is relatively not so traumatic of having to push it through the other way.
Yeah,
and sometimes it works pretty well. So I can't guarantee it'll definitely go to plan, but I'm thinking that usually it's always worked very well for me in the past. If you want, I'm happy to show it to you tonight.
Yeah, well, how can you describe what you do exactly?
Yeah, sure. So if we can imagine this is our tongue here, okay? And we've got this fish hook coming in through this point here. There's our little
that's pretty much what it is, which is, it's embedded in the tongue.
Okay, so either you've got to try and push that all the way through to the other side, clip it off, and then get it all the way out.
Yeah.
The other alternative is how I've sort of managed is essentially we get like a pair of either needle drivers or forceps and basically grab a hold of this section here, okay, with that, and then pretty much in exactly 180 degrees the other way, we just get a bit of suture material and we wrap that around this point here.
Okay.
And now, with this side, while we're stabilising this, we're going to pull very quickly and firmly
in that
the
direction.
opposite direction the other way. And we see, for some reason, it just, with the barb hook, it seems to cause less trauma, and it can usually come out in a matter of a few seconds once we get it going.
Really?
Yep. Well, we'll see how it goes tonight, if you're happy to give it a go.
Yeah, I'm happy to give it a go. And yeah, I've never seen that done before, but if that works, let's do it. Let's give it a go.
Excellent.
That's nasty. Oh, that's going to be sore.
It's going to need a good flushing afterwards for sure.
Yeah.
So how I'll get you to maybe hold it for me, because I'll probably get...
Yeah, you tell me what you need me to do.
Almost just hold the tongue for me like this.
Yep.
Okay, then I'll essentially have one hand on it here, and I'll be wrapping the other bit here, and I'm just going to go like that, the other way.
Not going to stick the fishing hook in my hand.
No, I don't think so. We stand in the right direction, it should be nowhere near.
All right.
I think it should be safe.
Okay. Yeah, cool. Let's do it. You feeling confident?
We'll see how we go.
I'm really glad that Ralphie's asleep. I don't think he'd put up with this if he was awake.
No, definitely not.
This is not pleasant. All right.
All right. So, when I say 3, 2, 1, we're going to pull.
Okay, just a minute. Yep, okay.
You got it? And 3, 2, done. Out.
Oh my goodness. Look at that.
and one go.
Wow.
Now it just needs a really good flush because there's still going to be some nasty sort of bacteria in there, but you can see pretty easy with not too much trauma at all.
Really good.
Dr. Lachlan has managed to remove the hook cleanly, leaving the German Shepherd with a good chance at a quick recovery.
I'm so impressed. When Lockie first told me about this technique, I wasn't sure it was going to work. It sounded a bit dodgy, but sorry, mate, but I didn't know. I've never seen anything like that done before. Normally, we push the hook through and we cut the barb off, and basically in doing that, we're creating another hole out the other side of the tongue. But with Lockie's technique, we're able to pull it out, and Ralphie's only got the one hole.
If we can find an easier way to do things without more complications, absolutely. And it's worked for me just about every time, so keep doing it.
Yeah, good job, mate.
The next important step is a saline rinse to clean the wound and help reduce the risk of infection.
That's heaps, eh?
Yep.
All right, cool. I can wake him up.
All right.
That was incredibly impressive. I can't believe he just pulled it out. We've got one hole. I reckon that'll heal up in no time. That looks really good. Hey, Ralphie, you go back to guarding your family. Ralph just needs a little bit of time to wake up. It's nearly midnight, but I've just heard that the whole family are coming down, even the kids. There's no way they were going to stay away. All right, back to bed? Back to bed. All right, come on, Ralphie, let's go. You're looking good. You ready to go home?
Ralph has woken up after the fishhook removal surgery, and he's well enough to go home.
The whole family wanted to be part of this reunion. Natalie put the kids to bed, set the alarm, and woke them up so they could all come down tonight.
He's a lovely dog, absolutely.
He adores my family.
Come on. Come on, Ralphie.
He does his job in terms of protecting
He adores
them,
all the
he's
animals.
very good with the kids, and that's all we can ask for.
Hey, baby.
Hey, buddy, how are you?
Come here. Oh, hello. How you doing? Hello.
I missed you.
It was such a lovely moment to see Aiden with Ralphie. It was Aiden's fishing rod that Ralphie got hooked on, and the poor boy has been so worried all day that he nearly killed his best friend. What do you guys think?
He's amazing. He's a very awesome dog.
It's all right, buddy. He takes cuddles and hugs very well, doesn't he?
He does.
Like his cuddles.
Very important. The centre of attention.
All that's left now is to take Ralph home so he can get back to work guarding their menagerie of farm animals.
Aiden, can I say goodbye to him? Yeah?
See you later, Ralphie.
Hey, you be a good boy. You look after your family, because they love you very much. Hey? All right, you guys take him home?
Yes.
All right.
All right.
Thank you very much.
See you later.
Bye-bye.
Yeah.
Thank you so much for
welcome.
everything.
No worries, Nat.
This week's number 3.
Hi, Alan. How are you?
I'm good. Thank you very much indeed.
I hear you've got a job for me.
In London, Scott's taking a call from his good friend Alan from the organisation British Divers Marine Life Rescue.
We've got a seal in Teddington Lock, and it has a horrible, great big hook in its top lip with a big fishing lure on it, and it's not able to eat very well, so we're worried that he's going to lose weight. So what we're going to do is try and get him out of there, hopefully tomorrow. And if you come down and actually try and get the hook out, that would really help us.
I've known Alan for many years now, and he really is an amazing guy. He set up the incredible British Divers Marine Life Rescue many years ago to help with injured sea life. And he has called me out all over the place. He's called me out in Cornwall and also to Norfolk. But this time round, it's just around the corner, only about a mile away from the practices. This rescue is in the River Thames.
You see that?
Oh, I see. And there's the lure right there. Wow.
I think it's in the top lip, so...
I really hope so. I've seen this in dogs, and as we both know, they're kind of like the dogs of the ocean in their anatomy. And what I'm thinking with that is seeing it is we almost need to try and chock something in between its molars to keep its mouth open for me to be able to lift that front muzzle back. And hopefully it is going to be just in the lip, because if it's in the hard palate, That's going to be a little bit more challenging.
That's going to be difficult.
Next day, a dozen volunteers are gathering at Teddington Lock on the River Thames, where the seal has been corralled.
It's pretty heartbreaking to see this seal in the lock. It's only been in the area about a week, and literally on its first or second day here, it's got this hook stuck in its mouth, which if left will probably cause its end. It will struggle to be able to eat. Eventually that will lead to starvation and death. So it's incredibly important that we remove this fish hook. Oh, hello. I can't wait to get that out of your mouth. Hey? I'm feeling a lot of mixed emotions right now. Obviously very excited as a vet to get my hands on my patient and just to see what kind of damage those hooks have done to this beautiful seal's mouth. But at the same time, I am quite nervous about the seal's mouth because they can lash out when they're nervous, they can bite really hard, they've got a lot of nasty bacteria in their mouth, and those infections can lead to a worst case scenario of an amputation of a limb.
But before Scott can extract the fish hook, the seal must first be captured.
So should we get the net out so we can line it up a bit?
No easy task in a lock that's 30 metres long. The plan is to sink a massive net into the lock and encourage the seal to swim towards it.
So that's going to go down one. So it's going to go down one side of the wall.
Adding to the complexity of the operation, London is battling a severe COVID-19 outbreak, so the rescuers must remain vigilant around the virus as well.
So phase one is getting the net in the water, which we've managed to achieve, but our prey is elusive, is just swimming around over there, having a lovely time, but staying very much away from the net. So phase two is getting the boats in the water and trying to encourage the seal to go over the net. This is a terrifying moment for the seal. It doesn't know that we're trying to help it, and it really is fighting for its life. Okay, lift it up. Yep. There's been occasions where the rescuers have tried to rescue animals like this and they've died because of stress. Today I really do need to be prepared for anything.
All right, coming up.
That's it. It's all right. Yeah, well, actually, I think that it's already pulled out. That's it. Let's have a look. Has anyone got a towel? Okay, baby. Yeah, I know you're grumpy. Good girl.
Just get that over its eyes. That's it. One and same again. Yeah, that's perfect. Well done. Thank you. I think unbelievably, the net has actually done my work for me in that it was present in the muzzle just here. But as
in the lip then, not in the gut.
yeah, so definitely in the lip. So what I'm going to try and do is just get this in between the teeth. Okay, so if you can just do a little bit of a release.
We then used the very technical bit of hose to shove in his mouth so I could check his hard palate at the top of his mouth.
There we go. That's it. Well done. Okay, bite on that. Get angry on that. There we go. Well done. So now I can just see, yeah, that's perfect.
Yeah.
Yeah. Yeah, so hard palate's perfectly fine, Alan. Yeah. So we're all good there.
Fantastic.
We've got quite a bit of swelling here. You can see the disparity between the two sides. So
I guess you'd expect that, really.
absolutely. If I had a fish hook in my face for a few days, I think that'd be pretty swollen.
And the great news is that although very swollen, there wasn't any other major damage beyond that. All of his teeth are healthy, there was no damage to the gums, and there's certainly no suggestion here that this seal won't make a full recovery.
After a shot of antibiotics, the seal is ready to be transported to a release site near a seal colony downriver.
Ready? Get on that door. Someone on the door? Yeah.
Very beautiful. Yes, you are.
But before the young seal heads off on the next leg of his journey, there's one more surprise.
We've just traced the tag and he's come all the way from Holland.
Well, that's confusing. There's no clogs.
So it's a male harbour seal called Freddie Mercury. Freddie Mercury was admitted as a pup in Peterborough and released last August.
It's amazing.
They travel around quite a lot.
From Holland to Teddington. Wow. Well, I love the fact that he's got a British name of a British icon and he decided to return to the UK. I think they went pretty well, Alan.
I'm delighted, actually. It takes a little bit of organising, and everybody came from all over the country, but as you saw, it either takes 5 minutes or it can take 5 days, so we're really pleased that it went so quickly. So the right thing to do is to take him down to the estuary now. We'll take him down to Sheppey and we'll release him in the Thames estuary, and he's then got a choice. There's a colony there, so he can either join the colony or he can go back to Holland. So we're really pleased.
Been a very good day. The sun's shining. We've got a lot of happy people here who have given up their Saturday, travelled a huge way to rescue a seal. And some people might go, you know what, it's just a seal. But these creatures deserve our respect, deserve to live and be healthy. So it's just great to have been a part of rescuing him, and now he's going to go off and enjoy a wonderful life.
Number 2.
Yeah. I was fishing, just baited the hook up, and yeah, before the time I could get the bait in the water, he swallowed it. So a bit of a bugger. I didn't catch any fish, but I caught my dog.
Harley, a 10-year-old American Staffordshire Terrier, has been rushed into the Bondi Referral Hospital SASH after swallowing a fish hook.
I actually pulled the line and didn't realise it was actually in his throat. Hope it hasn't wedged in too far.
Hi, I'm Lisa. Nice to meet you.
It's a quick consultation with emergency vet Lisa Chimes.
So we'll x-ray his chest to have a look if it's in his esophagus, and we'll also x-ray his abdomen to have a look if it's further down. Come on, Harley. If Harley's esophagus has to be cut open, that's going to be awful news for Chad. It's a delicate operation, and the risk is that his esophagus or food pipe may never heal properly, and Harley may never be able to eat normally again. You'd be good for this, Harley. Oh no. Oh no, you don't. All right, bud. Harley. All right. Excellent. It's not going to work, is it, mate? Right, sweetheart, look. Your tail's wagging. I know. We'll try and do this without sedation.
10-year-old Harley has swallowed
Harley,
a fish hook.
Harley.
Lisa needs to find exactly where it's lodged, but the powerful Staffy is winning the battle.
Little sting. It's a boy. Good boy. That was very brave, Harley.
A quick sedation has now stacked the odds in Lisa's favour.
Now, round 2. There, you're a good boy now with some happy juice. Hey, it's a good boy. Harley, 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 Harley. Oh, darling.
Outside, an anxious Chad is waiting for news.
Yeah, I've got 2 kids, 10 and 8-year-old. He was with us first, and then we had our daughter 6 months later. And yeah, so he's like one of the kids.
Apparently, Dad's in the bad books.
Yes, I'm always doing something wrong. Always.
Oh dear. The hook is in his esophagus. You can see it right there. We can't leave that there. That needs to come out. See what you've done? Look. Piquet, that's a boy. You lie down.
At SASH, specialist vet Darren Foster has the tricky job of trying to remove Harley's deeply wedged fish hook without causing permanent damage.
I'm always worried about esophageal foreign bodies because they can go really well and can be quite spectacular, or they can be quite difficult to do. And there it is. Fish hooks are particularly difficult because you don't have much room to move, and they're quite sharp, obviously, and there are a lot of important structures around the esophagus, like arteries and veins, that we might hit if we turn the hook in the wrong direction. And if we can't get it out very easily, then we'll have to send him to surgery, unfortunately.
The frustration is building as the minutes tick by and there's no result.
At the moment, it's looking like he's going to need to have surgery, but we don't like to do surgery on esophagus because they just don't heal very well.
I don't think this is going to work.
afraid. But this is going to work. I'm afraid.
The team at SASH are attempting to remove a fishhook wedged into Harley's esophagus on his very first fishing trip. After 40 minutes, Darren Foster is almost ready to give up.
They've got it.
No, you don't. You got it?
We've got it. Just a threat of surgery.
You see?
It does have a barb on it. I had given up. I just thought I'd give it one more shot. And it worked. So he only has one little hole in his esophagus there, just a little puncture wound, so that should heal nicely.
We've seen things from fish hooks to tampons to pantyhose, and most of the time we can get them out, but there are always the tough ones that get stuck in there and have to go to surgery, and Harley was looking like that, and Harley's a very lucky boy. Yes.
At SASH, Harley, the world's worst fisherman, is ready for release.
Oh, there's Dad! Well, he's a very lucky boy.
That's good.
Here's the hook.
The dreaded hook.
Late last night, the American staffy was just seconds away from having his esophagus cut open to remove a fishhook.
Good luck, take care.
All right,
no more fishing for
No,
him.
no, that's for sure.
It's a good result for Harley. He's got no permanent damage. He'll have to eat soft food for about a week and then he'll be back to normal. And I think we really gave him excellent treatment here, and he just wasn't very grateful. He showed us his opinion of the place as he walked out the door. Cheeky bugger.
And this week's number one.
He was completely tangled. We managed to unravel him completely and gave you guys a call, and he's sitting in the back of the boat right now waiting for some help.
Recreational fishing and ingestion of fishing lures and fishing hooks, or simply just entanglement from the fishing line, is such a common problem for our marine wildlife. Birds are usually the most common species that we see implicated. It is a huge problem for our marine life.
As Scott continues his working holiday in Australia, he's left Sydney and has now travelled north to Queensland's famous SeaWorld.
Today I'm here on the beautiful sunny Gold Coast to meet with Claire Madden, who's the head vet at SeaWorld, but also she's incredibly dedicated to the rescue and rehabilitation of marine wildlife. All right, well, let's go and catch a cormorant and hope we don't get a chunk taken out of us. There we go, hi there. Wow, so you can see that line just caught there.
Another little hook there in his foot.
Hook in his foot as well.
Well, thank you very much for that, and hopefully you can help him out and get him back into the wild again.
Fantastic. Well, I'll be sure to give you a call once we have a look at him today.
No problem.
Scott and Claire must urgently try to remove the fishing tackle before it causes potentially life-threatening damage to the cormorant's digestive system.
All right, come on in.
Thank you very much.
You want to open the door for me?
Yes.
I'll go in and get him. These guys are incredibly bitey, so I'll restrain the head and body. And if you want to help me with the anaesthetic, so just bring the mask over his beak for me and we'll go from there.
Perfect,
All right,
good.
let's do this. All right, so I'm just going to pop. Oh, is that right? Just expose that head. Yes, we'll make you better. You just want to pop that mask over here. That's it. And we just wait.
So what are we expecting with this particular procedure? Because he's got the line there, but we just don't know how far the hook goes.
Yeah, so I mean, a lot of these hooks do get caught up in the throat or the esophagus, but sometimes we do see it as far down as the stomach. So we'll take a quick X-ray and determine where it is.
Yeah, good plan.
Once the cormorant Scott has decided to call Kevin is asleep, a tiny camera will be inserted down its throat to see how far the foreign body has travelled.
What's going on the inside? Oh, look, and he's got another one there, Scott.
Wow.
Oh, the poor little thing. So he's got a hook in both of those feet and the fishing line down his throat.
It's awful to think in his natural environment there's so many things that are man-made that are causing him problems.
That's it, and these soft lures just look like fish to these guys.
Before checking any internal damage, Scott's removing the fishing hooks embedded in the seabird's feet.
How'd you go with that fish hook?
Yeah, that came out fine.
Great.
He also discovers an old injury to Kevin's wing, with discarded fishing tackle again the likely culprit.
Marine wildlife is incredibly inspiring to many people. It's a lot of the reason why we go to the ocean and we go to our waterways to see these creatures in their natural environment. But we're causing such damage to them on so many levels: habitat destruction, activities that we perform, and how much they're causing injury. And for us to continue to enjoy these wonderful creatures, we do need to make some changes.
Okay.
Oh, wow. That is...
Check this out.
Look at that.
So you can really clearly see it's a soft lure with the metal work and then that hook right there down in the stomach.
Brilliant x-ray, but also I can see that left wing where we found that wound, there's actually no fracture. The bone is completely intact.
We have no bony involvement, so there's no evidence that this bird has a fracture, new or old.
It's good news for Kevin's wing, but the x-ray has revealed the fishing tackle has moved dangerously into his stomach.
All right, I'm just going to pass it. If you can just hold his head up for me. That's it.
An endoscope search will help Scott and Claire find the hook's exact location.
So there's no hook, no hook, no hook. There we go. I think that's a big lure in front of us. Soft plastic. See that there? Good. What we need to do is find that hook. There's a hook there.
Wow.
If the sharp hook is wedged into the stomach lining, it will be causing pain and be almost impossible to remove without risky surgery.
Scott, it's not embedded. It's just sitting on top of the mucosa there. Yep. So this is really good. So we'll just pass an instrument down now and we'll grab that hook and then we should be able to pull it through because it actually hasn't anchored in into any skin. Amazing. So this is a great outcome for Kevin, good for the bird. Alrighty.
Using an endoscope, which is basically a camera at the end of a tube, we can see the lure in all its glory, which is basically sort of a rubber piece with the hook. But the great news is that the hook isn't embedded in Kevin's stomach.
You've just got this little plunger apparatus up and down, which will just open and close those pincers. So keeping it closed and open when I say so. So I'll feed this down the channel.
It's hoped a grappling attachment on the endoscope will help to remove the barbed hook safely.
Yep, there we are. Great, we're out. Bit of a team effort. Couldn't do it without you here.
Worries. Happy to help.
How about we get it out?
Absolutely, let's do it.
Scott's job is to grab hold of the dangerous hook so they can extract it. Everyone is hoping they can avoid high-risk surgery.
All right. There's our hook. Okay, open.
Yep.
Okay, close.
Yep.
Okay, if you just want to grab, we've got the top of that hook.
Yep, I've got it.
It's just this little junction.
So we just got to hope that hook doesn't get caught on the way up. Most animals have a structure called an esophageal sphincter. It's basically just a tightening between the esophagus, the food pipe, going down to the stomach so the food doesn't just slosh out. But in Kevin's case, it's making the lure impossible to pull out of his stomach.
So that junction.
It's been pretty tricky, isn't it?
Oh, look, they're never straightforward, these cases.
As repeated attempts to remove the fishing lure and hook fail, there's now a new problem. Kevin is waking up.
Burn anaesthetics up and down.
Oh, yeah.
Up and down. I always find the anaesthetics of birds really tricky because they have a different respiration system than we do. They've not only got lungs, but they've also got air sacs. And it does just make anaesthetics more difficult, and they tend to go really deep. You can hardly hear their heartbeat, and then they go really shallow and try and fly off the table. It does make for a very stressful anaesthetic.
How's our patient?
Yeah, fine. Yeah.
With Kevin's anaesthetic back under control, Scott and Claire try one last time to retrieve the stubborn fishing tackle.
It's so big. I don't know how he swallowed it in the first place.
he'll probably have to have surgery.
It's a disappointing outcome.
Unfortunately, removing a fishhook or a lure is not a straightforward process. Sometimes we simply can't remove it, which is the case with Kevin the cormorant. You're waking up now. That does mean that we will need to do open surgery, which comes with increased risks and prolonged rehabilitation time. And unfortunately, if it is severe enough, euthanasia is sometimes our only option. All right.
Kevin's surgery is scheduled for the following day.
So a pied cormorant?
Scott and Claire's next patient is another cormorant with the same problem, sent to her from a wildlife hospital.
This particular bird came to the girls at Byron Bay Wildlife Hospital. They saw a fishing line coming from its beak. They've taken an x-ray which shows quite a large fishhook sitting in the throat of this bird.
I am only here at SeaWorld for just one day, and to see two cormorants suffering with the same condition is really, really upsetting. It just shows that this is a massive problem.
This guy's got a decent looking beak on him.
Alrighty, in you go.
Ow, ow, ow. Ow, ow, ow. Got the head.
Got the head.
Yeah.
And then we'll bring him out.
There we go. All right. No more biting.
And I'll just grab that head.
Thank you.
You want to come around the other side?
Yeah.
You're all good
Yeah,
there.
he got me. He got me.
Now, you know what they usually use this beak for?
Catching vets.
Yeah, you got it. I nearly got another one. There we go.
Unlike Kevin, the fishing tackle hasn't gone as far into the bird's digestive system.
Okay, close.
Yeah, I've got it.
Okay, moment of truth. No way.
There we go.
Yay! Oh, gosh. Oh, that was traumatic, wasn't it? Wow.
Wow. Always such a
Teamwork
challenge.
makes the dream work. Yes! Nice.
Love it.
Oh my gosh.
Oh, I so needed that today.
Oh gosh. I tell you what, I'm so glad I'm listening to his heart right now because mine has stopped for a bit. All right.
What a day.
What a day. Let's wake this guy up. Claire and I are finally able to take the hook out of this second cormorant, and we are very overexcited. We're overjoyed because the first cormorant, Kevin, we couldn't get that lure out. It was really tricky. So the second one, we've got to win, and this guy will be able to be returned to the wild straight away. One less hook for you. Eh?
If you guys loved that video, great. Make sure you subscribe to our YouTube channel below. That way. That way.